Good morning, good afternoon, delegates, excellencies, and participants, and also colleagues. And I welcome all of you to this first webinar on the waste management in the wake of unfortunate pandemic COVID. So from the United Nations Environment Program in the Regional Office for Asia and Pacific, we will have a series of the webinars, and this is the first in the series to provide overall overview of the waste management importance to avoid any unfortunate pandemics in future and also how to reduce the severity. But you will learn a lot during this webinar. But my request, first of all, to all of you that please mute your mics and turn off your videos. And we are recording this session, which will be again posted back on the YouTube and other channels. And number two, please post your questions in the chat box. And so all the speakers will try to reply those questions during question and answer session. But if some are not picked, then we will ensure all the replies are posted back. So now, without further ado, as it's getting 2 p.m. in Bangkok, I would like to request Regional Director and the Regional Representative for Asia and Pacific for United Nations Environment Program, Dr. Dechen Sering, to provide us the opening remarks. Dechen, floor is yours, please. You're muted. You're mute.
Okay.
Yeah. Now, okay.
So, Excellencies, good afternoons, ladies and gentlemen. Welcome to the first dialogue of a series of dialogues and webinars on sustainable waste management. I would like to thank UN SCAP, UN agencies, UN country teams, governments, and partners for their active collaboration during the pandemic and post-pandemic response to COVID-19. Ladies and gentlemen, this unfortunate pandemic, COVID-19, has provided an opportunity to reassess our action for nature. On the one hand, we've seen a visible decline in various types of emissions, including daily global greenhouse gases, due to the shelter in place. This can help us understand how positive behavioral change can lead to big wins for clean air and reduction in greenhouse gas emissions. On the other hand, we've seen an alarming increase in plastic waste and a substantial decrease in plastic recycling. Sources of increased plastic waste are related to the use of plastic for medical use and packaging. The global, regional, and national net plastic demand is yet to be assessed in the context of the pandemic, but plastic demand in the medical sector, which helps in combating COVID-19, you're talking about face shields, gowns, vinyl gloves, disposable bags, tubes, masks, among others. The vast demand for food delivery or takeout as well as grocery delivery increases the use of plastic material for food packaging. So when we start to understand the situation, the World Economic Forum cited a study and they said that if in the United Kingdom, if every person used a single-use face mask a day for a year, we would have 66,000 tons of contaminated waste, 57,000 tons of plastic packaging. The Thailand Pollution Control Department recently reported the amount of plastic waste, especially plastic packaging, increased by 50% from 5,500 tons to 6,300 because of a tripling in food delivery. And in Singapore, there was an additional 1,334 tons of plastic waste from takeaway and food delivery. Many countries are yet to develop environmentally sound management of waste, including recycling. This mismanagement will put enormous pressure on terrestrial and marine environments. We've seen many images of pandemic-related plastic waste strewn, masks and gloves all over the land and in the marine environment. Understandably, ocean pollution is increasing as some 8 million tons of plastic enter our ocean every year, adding to the estimated 150 million tons already circulating in the marine environment. For medical waste, in Wuhan, and in addition to new hospitals, they constructed a new medical waste plant and deployed 46 mobile waste treatment facilities. They found hospitals generated 6 times as much medical waste peak of the outbreak as it did before the crisis began. The daily output reached 240 metric tons, about the weight of an adult blue whale. There's already been an increase of garbage from personal protective equipment, and in the United States, according to the medical waste company Stericycle, they handled 1.8 billion pounds of medical waste globally in 2018. And some items that aren't considered medical waste, like food, now need to be handled more carefully after coming in contact with COVID-19 patients. To support member states and stakeholders, UNEP's COVID-19 response, working with the environment to protect people, we've identified 4 main responses: the medical and humanitarian emergency phase, a transformational change for nature and people, investing to build back better, and modernizing global environmental governance. The first response focuses on raising awareness on pandemic related waste, to raise awareness and to prepare for managing waste effectively, to manage waste to control the spread of a pandemic, and to treat waste in an environmentally sound manner. UNEP is supporting different aspects of waste management, strengthening regulatory and frameworks, enforcement, waste management strategies, including tackling hidden sources of waste generation, which are critical for pandemic control, such as animal waste and waste from the illegal trade of wildlife. 9 fact sheets have been produced and translated into major languages. Sustainable waste management also helps small medium enterprises, as it provides proper waste management, recycling, connecting back recovered materials in the supply chain to be used for packaging and for medical supplies. I hope this first dialogue will help to start the discussions leading to the creation of partnerships and knowledge for supporting governments and stakeholders to support resilient and green waste management practices during the COVID-19 pandemic and post-pandemic response period. I wish you very successful deliberations. I thank you all.
Thank you very much, Dr. Dechen Sereng. Thank you very much for the great insights. So now I would like to start with my first presentation as to provide the overview for this whole webinar, and then we will get into the more details with our distinguished speakers from different parts of United Nations Environment Program. So let me start with my presentation. Okay, so I hope all of you can hear. And
Yes.
yes. Good. Okay. So why we are today talking about the integrated waste management in the wake of COVID-19. So the whole point is to bring the understanding that it's only through the integrated waste management, not through the segregated or the segmented actions, we can create a major impact as a resilience or as also the mitigation for the pandemics. And that's where also we will bring that what are the different enablers like regulatory frameworks, the technologies, financing mechanisms, and so on, are very important to be in an integrated manner. So that's why we chose that we first provide the overarching today's dialogue on the integrated waste management, and then in the later webinars, we will go on narrow down or focused on technologies, financing, regulations, and so on. So as Dr. Dejan Sereng mentioned that UNEP's strategy or UNEP's response for the COVID to support the member states and the stakeholders has been designed to working with the environment to protect people. So this is a very important aspect to see that how waste management helps to protect the environment, and that in that way also we protect the public health, biodiversity, and even these pandemics. So under these 4 responses, the first response, which is the point for today's discussion, is about the medical and humanitarian emergency phase and how we can deploy our integrated waste management systems in this type of pandemics. First, to reduce the severity of the impact, and number 2, to create the resilience. So for that matter, under this response 1, a United Nations Environment Program has pulled together 9 fact sheets. And number 1 is introduction to the COVID-19 waste management. Number 2 is a national medical waste capacity assessment. Number 3 is how to choose your waste management technology to treat COVID-19 waste. And number 4, policy and legislation linked to the COVID-19 and pandemics. 5 is links to the circularity, especially for non-healthcare waste or recyclable waste. Number 6, linkages of air quality and COVID-19. 7 is a household medical waste management strategies, which is key. And 8 is a disaster conflict affected states and vulnerable humanitarian operations as pandemics affect them the worst. And last is about the wastewater and sanitation in the wake of COVID-19. So these 9 fact sheets are already available in English, and we are now getting the translations done in major languages, including for this region, suppose in Chinese, Hindi, and Arabic, French, Portugal, and so on. So now we come back to understand the importance of the integrated waste management. Okay, with pandemic, the first word came to everyone's mind is a medical waste, because there's a lot of pressure on the medical facilities. The in and out patients have increased enormously. Then also because of the ventilators and so on. So there's a lot of medical waste, and we can see from this statistics which ADB has collected that in Asia Pacific region, there's a huge increase so far. And these statistics are just very basic, because there's a lot of inventory work is going on to see that how much really the increase in the medical waste. So the first and very important point comes to the mind that we should address only medical waste. But then let's move to the second to see that along with medical comes the plastic waste, because we saw a lot of even the medical packaging, the masks, the tubes, gloves, and everything is about the plastics. So some plastics are hazardous, but then also the other plastics like packaging, food deliveries are non-hazardous in this pandemic side. So that also brings to see how we can create the integrated systems. And then, as Dr. Dejan already mentioned, that we are getting inventories now done to see that how much increase in the medical and plastic waste, and especially to understand what materials within the plastic waste or medical waste, because medical waste per se has a different types. Some are the like sharps which can injure, some are the infectious medical waste, and so on. So there are different types, and similarly in the plastic waste also there are similar different types of plastics involved, and that's very important to understand the whole life cycle of those medical waste and the plastic waste to create the integrated waste management systems. And as we also saw that with the increase in the personal protective equipment, including masks and so on. They are now floating in the rivers, in the oceans, and they are spreading in the forests and so everywhere you have a sight of those masks, gloves, and so on. So that's one very clear indication that it has to be addressed, because not only it's creating a lot of impact in the environment, but they also may carry a lot of infections and so on. And then also we can look into the what type of mask. Suppose WHO yesterday, they issued a new guidance that reusable masks could be weared in the offices and so on. So as the UN partners and others, they are increasingly involved to assess and then drive a new SOPs on this. We have to also understand then what type of waste will be coming into the waste streams and so on. And also learning from the other countries. Suppose in Wuhan, where this coronavirus started, their first focus was to create the additional facilities for medical waste, because as we will discuss that the waste overall and also the medical waste per se needs a special attention during the pandemics and so on. And then also we already saw that plastic waste, which was a major challenge in the region already. And there was a lot of focus before the COVID on the plastic waste. Even in Thailand, for example, the plastic bags and everywhere. So in all countries, they started focusing on the plastic reduction or the recycling the plastics. Unfortunately, with the pandemic, on the one hand, we saw the increase in the plastic waste, but also decrease in the recycling of the plastics, because there were the fears for the plastics being infectious, and also the waste management declined because of the lockdowns and so on. So we have to look into the whole integrated systems, how to improve the situation for that. But before getting to the solution side, the first thing to really look into the principles of a disaster waste management, because pandemic itself is a disaster. And we will have a detail like discussions later in the session, but just to raise the point that there are 4 principles for disaster waste management. One is a prevention, one is a preparedness, third is removal, fourth is a recovery. So we have to also deploy the same principles for the waste management during the pandemics. For example, in 2011, when Bangkok got flooded and the water was 2 months there and many houses were submerged, they had to deploy the boats to collect the waste, and they have to have a temporary storage points uphill. Similarly, for the pandemic waste, all the staff, the services has to be designed accordingly with the personal protective equipment, with the proper disinfections and so on, and also the command and control. As we see the disaster management authorities, they take over the control and so on. So also the institutional control. So there's a bit of a change. So that's why it's very important to understand that during the pandemic, integrated waste management has to be designed based on the disaster waste management principles. Now coming to the solution side. And when we look on these solutions, again, we are committed to the Sustainable Development Goals. We are committed to the Paris Agreement for the climate change with the NDCs. And also we are looking on the economic growth, the mass consumption. Even during the pandemics, we saw huge online orders and delivery and so on. So in this region, this mass consumerism is at its peak. So how we are going to address that? And in the linear form, if you can look that we take the resources from the nature, we use that, and then we put back the emissions, waste, and so on back into the nature, again contaminating the limited natural resources. So this linear model is very harmful. Now, how to create the circularity? So on the one hand, we still enjoy the quality of life, but on the other hand, we reduce the impact of the natural resources and reduce the contamination of the natural resources. So this is the whole dimension along with the Sustainable Development Goals or the climate change in the wake of new Green Deals and so on, very basis for the integrated solid waste management. And also the interesting point is that the countries who grow economically, their waste increases. But also we have seen that the countries who have been rich, they invest a lot into the waste management. So that creates a lot of challenges for the countries with a low economic growth to how to invest into the waste management systems. So that means the downstream waste management is very expensive. So again, we have to look into the circularity to reduce the waste or reuse and recycle back into the system to avoid expenditures in the waste management system. That's why the circular economy comes as the very handy, that we look into the life cycle, even for the medical waste, even for the plastic waste and all the waste, to see what we can recycle, what we can recover, what we can reduce, and what we have to treat and destroy properly in environmentally sound manner. So to do that, we have to identify the roles and responsibilities. Now, on the one hand, what is required for integrated waste management? Financial resources, technologies, environmental regulations and procedures, social behaviors. And on the other hand, the stakeholders, suppose waste generators, what's their roles? What are their responsibilities? Service providers, including the whole value chain, recyclers and so on, regulators, governments, and then the businesses, and also the community. So when we look on this whole value chain, starting from the waste generation, then we can have upstream actions to reduce the waste and downstream actions to properly segregate, collect, recycle, recover, and environmentally destroy the hazardous waste and so on. So to do that, UNEP over the at least 2 decades had provided intensive support to member states, to the cities, to the stakeholders, and one of the key is on the waste data. UNEP has established the methodologies, guidelines, and trying to create a lot of awareness that institutionalize the inventories, the data, so it's updated on yearly basis. So that provides insights that what to, and where to invest, because investing in waste management is very expensive. So that data is very important for the planning purposes and for real deployment of the technologies and so on. Then also the UNEP supports on integrated waste management through the regulatory framework. So we have provided guidance on the regulatory frameworks. We have provided the guidance on the sustainability assessment of the technologies, financing mechanisms, business models, including the new models like a leasing, sharing, and to take a control of the inventories through the life cycle and so on, and also the behavioral sustainable lifestyles. That's where the major focus is also. So the important message should be coming that when we say it's a waste, what really we are wasting in that material, like a PET bottle, how the PET bottle is created. So one is the material, what we see in the PET bottle, but what are the processes to get that material from like a fossil fuel to the PET bottle and so on. So we have to look on the capacities and everything that are wasted when we call it a waste. And then to design the circular economy, as I mentioned, that is United Nations Environment Program, they have quite a lot of tools, including on the sustainable public procurement, including on the sustainable lifestyles, and also the consumer information, or even the mainstreaming, the SCP for the whole value chain. So through our One Planet program, we are trying to support the different sectors like food systems, tourism, construction, and manufacturing, and so on. So it's also a point that we have to go sector by sector to see the different needs for the circular economy along each sector. And there's a list of UNEP's toolkits and trainings, as I mentioned, all over at least the 2 decades, and which are available online. And you are welcome to go through that, and we are available for any support on that. Now, before concluding, let me put on some of the major challenges for integrated waste management, which we need to put in place. The regulatory frameworks. As we know, that there's a lack of the updated policies, especially on the emerging or new emerged waste streams, like even the plastic waste or this medical waste or e-waste and so on. Then number 2 is the institutional arrangements and enforcement at the national level, at the local level. The different departments in different countries are responsible, the public-private partnerships and so on. Financing, as I mentioned, waste management is a very expensive business, and we have to know how to finance that. And one way is also to reduce the waste, to reduce the costing and so on. So that's very important. Then the business models, even for the private sector, as a private sector is not a charity, they need to generate the profits. How they can generate the profits out of waste management. So there are different business models, as I say, even having a total control of the inventories and so on. Then the technologies and infrastructure, as UNEP has been supporting on the sustainability assessment of the technologies with the local criteria and so on. Informal sector, as we all know, and during the pandemic, we see so many of the photos that impact on the informal sector and so on. It's very challenging, and we have to address that. Behavioral changes, as I say, the source segregation, reduction of waste, reuse, recycling, that all requires that. So the last slide is on the key discussions, which we can discuss today or in the coming days or months, that what areas of waste management are priority areas in your countries, and what policy support investments are required upstream and downstream, and how most of that could be done through South-South cooperation. As in Asia, we know that there are so many strengths, so much of the competitive advantages many countries have, so we can bring that through South-South cooperation on the table. So with that, I would like to thank you all, and I will now would like to invite my next speaker, and she's a senior program officer from Law Division in the United Nations Environment Program in the head office in Nairobi. So Aphrodite Samagadi, floor is yours. Thank you.
Yes, thank you, Mushtaq. Good afternoon, everybody. Good morning from Nairobi. So we are going now to speak about integrated waste management, regulatory frameworks. Let me share my screen. Okay, do you all? I hope you all see my PowerPoint. Now, waste management is an essential public service. Most countries have in place waste management frameworks. These are some examples of emergency measures adopted or that countries had to apply, and it's by no means an exhaustive list. These are countries from the region. A lot was done also at the municipal level, as local governments are the key implementers of waste management, and they are those developing waste management plans. Now, because of the current situation, countries are called to rethink waste management regulatory and institutional frameworks. How much integrated and coherent are they? If governance models and enforcement mechanisms are already effective under normal circumstances, there will be a better foundation for emergency response measures. So this is an opportunity now presented to strengthen the integrated waste management and sanitation sectors. Countries were faced with particular challenges in the times of COVID. Different types of waste, contaminated, sharp healthcare, also called medical or clinical waste, household waste, animal waste, and of course the plastic crisis was aggravated in many countries. The waste was produced in increased quantities. Then there was a greater risk for adverse effects of waste management processes and their increased use on the environment. A lot of emissions from the increased use of incinerators, especially if those were improperly operated or poorly maintained. Then there is fragmented legislation. Different types of waste or the processes may be regulated under different pieces of legislation in every country. Sometimes there was a lack of legal basis for the adoption of urgent measures. There was a lack of institutional capacity, and there is a focus on health. And here there is a fine balance for countries to find between, on the one hand, preventing the disease, and on the other hand, ensuring that waste management does not adversely affect the environment and human health. These are some action. What do the countries need to do? These are the action points. First, look at the national, medical and other waste management policy and legislation, identify gaps and try to cover these gaps. Then prioritize in-country management of the waste. And finally, monitor the increased import and export of the waste in case that there is no capacity to treat the waste in country and close to the source. Of course, we said this is an opportunity for countries to review their whole integrated waste management legislation, but we are going to focus here on what needs to be done when it comes to emergency measures. And there are three main aspects here to look at. First, the type of instrument and the legal basis for the emergency measures. Second, the coverage and the scope. And finally, monitoring, compliance and enforcement. Let's break down these three aspects. Countries should assess existing national frameworks to determine what are the provisions for expedited adoption of short-term emergency measures that are needed for the pandemic, and what is the type of instrument chosen for adopting such measures. These aspects may be included in waste management or other legislation. And then on the basis of the assessment, introduce changes that are required for the effective and agile response in the future. It should be kept in mind that any measures adopted to deal with the situation should be temporary, and they should include safeguards for their review and clear grounds for extension. For instance, such safeguards can be environmental safeguards, the values that we have on the air pollution or land pollution from the application of these measures. Secondly is the coverage and scope of the measures adopted, and this is the meat of the emergency measures. They should provide for the type and the origin of waste, healthcare from households, also provide for the quantities and how they're going to be treated then under the technology and type of process for the waste management, starting from segregation, collection, disinfection, all the way to disposal and elimination, monitoring of export and import of any increased quantities, who are the responsible institutions, the operators and professionals, and also do we need to provide for measures to facilitate their work in a crisis situation, in an emergency, such as do we need to expedite procedures for their accreditation or the issuance and renewal of licenses. Then measures to prevent any negative effects on the environment or to restore the environment in case of damage, taking into account the precautionary principle, the polluter pays principle. And also there are other issues to be covered by the measures, for instance, liability and insurance, occupational health, taking into account that the exposure and workload of sanitation workers rises during these times. In doing that, in crafting the scope of the measures, international norms should be observed, and this include treaty obligations, such as those under the Basel Convention, and also best practice, such as the World Health Organization guidance on the safe management of waste from healthcare activities. Even if we have the most comprehensive waste management framework, this is not effective unless it's properly implemented and enforced. This is why monitoring, compliance, and enforcement are also key elements. So the measures should provide for reporting obligations of those responsible for carrying out waste management processes, the mandates for monitoring not only of the implementation of the waste management measures, but also of the state of the environment, coordination amongst the different actors, penalties, and also economic incentives. How can we stimulate small businesses to comply with the measures? Now, what does the National Environmental Law Unit do? We provide legal advisory services and technical legal assistance to developing countries and countries with economies in transition to develop and strengthen national environmental laws. We develop tools to advance national environmental regulation and ensure wider appreciation of evolving national environmental norms, approaches, and mechanisms. And here I would like to mention specifically the 2016 guidelines for framework legislation for integrated waste management, or the 2018 Global Review of National Laws and Regulations on Single-Use Plastics and Microplastics. And actually, now we are working on guidance to serve as a repository of best practices and lessons learned from the COVID-19 response. We hope to have this completed by the end of 2020. And finally, we also support implementation of compliance with and enforcement of environmental law. This is done mainly through capacity building activities and training of legal professionals, but also of non-legal professionals who are involved in the enforcement chain, such as police and customs officers. I would like to finish with a quote from our director. Strong laws and institutions are essential for countries to respond to COVID-19 related waste management challenges in a manner that avoids negative long-term health and environmental effects. Thank you very much for your attention, and I'm looking forward to any questions you might have to discuss. Thank you.
Thank you very much, Afro. It was really a great insights, and as our regulatory framework work is being done by our law division, and they are leading on a lot of also that combines the multilateral environmental agreements like Basel, Rotterdam, and Stockholm. So that's quite a good intersection that where you can see the national regulations, where you can see your obligations to the international agreements and so on. So we will get back to in the discussion time there. So now I would like to invite my other colleague, Dr. Lisa Gopi. She is the regional coordinator for environmental disasters and conflicts for Asia and Pacific in United Nations Environment Program. So Lisa, floor is yours, please.
Hello, it's nice to be here, and I'm going to just start by sharing my screen. I hope that's clear. My name is Lisa. I'm based in Bangkok, and I'm talking today about waste and disasters. I'm going to start with an outline, a framework, I suppose, in our region of a caseload of 1 million people across the Asia Pacific. And this means that globally, the COVID-19 virus has not slowed. The only change is in the countries being affected. So in the Asia Pacific, there is a risk of future waves of COVID-19, even for countries that don't have any caseloads at the moment. So my key point, I suppose, the one key message I would like to convey in this 10 minutes is that preparedness and contingency planning for waste management is more important than ever. And particularly for countries that are still in states of emergency or may in the future return to states of emergency under the pandemic or disasters, coordination between many partners has become necessary, and making sure that all of those partners understand the environmental impacts and the health impacts of waste is more important than ever also. I'm going to highlight a couple of hotspots in our region. First of all, countries that have low capacity health systems also generally have poor medical waste management systems. And so this means a high risk for human and environmental health and high level of need in COVID-19 times. And this picture shows a hospital in Kabul which was recently attacked by armed gunmen. So it's obvious that under these conditions, protecting environment and human health from waste is extremely difficult. Next, waste management systems in most countries are now stretched by pandemic and or lockdown conditions, and any disaster will make a new waste problem. For example, in India, it was feared recently after Cyclone Amphan hit that infectious waste had mixed with the widespread waterlogging that the cyclone had caused, and that this may lead to further COVID-19 risks. Now, even when a country has no COVID-19 cases, lockdown will impact disaster waste management, as the Pacific Island states found when they were recently, 4 of them were recently impacted by Tropical Cyclone Harold. And one of the problems they found there was that they couldn't import extra capacity or technology to deal with the waste and debris caused by the cyclone because of lockdown conditions. And finally, vulnerable people like displaced populations, those living in urban slums, and waste pickers are at heightened risk. And it's been estimated that up to 90% of the population of people in the high density camps in Bangladesh, in Cox's Bazar, may become infected with COVID-19, 90% of the population. So it's likely that waste technology and capacity will not be able to sustainably manage waste in those situations, particularly as waste systems are stressed in normal times in these kinds of environments. Now, we've spoken already about the types of problems around household waste management and medical waste management in these times. And what I'd like to stress with this slide is that disaster waste management comes on top of all of these things, and that cumulative stress on systems, technology, and capacity really means that integrated waste management needs to consider now the additional stress that disaster waste management systems need in case of disasters. So a major disaster can lead to vast amounts of waste. For example, the 2011 tsunami in Japan created 30 million tons of debris, which equals nearly 5 Great Pyramids of waste. In one city, one day's waste was equivalent to the waste generally generated in 103 years. So disaster waste includes household waste, medical waste, debris from damaged and destroyed buildings, agricultural areas, industrial waste. In a disaster, this all can become mixed together in the environment. And so I come back to my first point, which is current contingency and disaster waste management plans, budgets, capacities, technologies will all likely be inadequate in our current COVID-19 times. First of all, recycling initiatives have halted during lockdown in many locations and in many countries. PPE and training for disaster response personnel are needed. Even if and when waste management experts can fly into a location after a disaster, they won't know perhaps how to deal with waste that may be mixed with hazardous and infectious material. Risk of infectious waste within disaster waste is a risk. face masks, tissues, medical waste, everything is going to be combined together and needs to be dealt with specially and specifically nowadays. Risks of trafficking, illegal PPE reuse, illegal dumping, all of those kinds of things could increase under disaster situations simply because conditions become chaotic and regulations sometimes fall apart a bit in disasters. And scaling up waste management in emergency response is difficult to do during lockdown. Emergency waste technology is often less environmentally sound and more harmful than our day-to-day business as usual waste technology. So imagine that this stressed system that many countries have now has the additional debris and waste from disasters. And if they need to adopt new management, often it can be things like burial pits and delivery to dumps, landfill, which is not ideal. And lockdown debris clearing and cleanups often include local capacity. For example, if you've been part of a disaster or a disaster response, you know that local people are often mobilized through cash for work or cash for voucher schemes. But it's very perhaps less safe these days to mobilize local communities to clean up disaster debris and waste because of this potentially infectious waste mixed in. There are guidelines available. You may be familiar with the Disaster Waste Management Guideline for Asia and the Pacific. There is a particular, a dedicated web page on the EHA Connect, the Environment and Humanitarian Action website on debris and waste. And EHA Connect also now have a COVID-19 special page. And it's already been mentioned that UNEP have released a series of fact sheets. Now these fact sheets were listed and gone through by Mushtaq, and I just want to highlight one thing. When undertaking inventory or assessment of COVID-19 waste management capacity, the technology, infrastructure, and so on, the cumulative stress of both the pandemic and potential additional disaster scenarios needs to be considered. This is important, particularly in high-risk and vulnerable locations, but as we know, the whole of the Asia-Pacific is the most disaster-prone region in the world. So if we're doing assessments and planning for COVID-19, we really need to collaborate with our national disaster management organizations and disaster management experts to make sure that the planning that we do includes potential disaster waste. We mentioned before about emergency measures and preferred and less preferred waste management technologies. And this is a table from one of the UNEP fact sheets showing that autoclave and sterilization is obviously ideal, but when we get to emergency situations, we really need to keep in mind that open burning and uncontrolled dumping is risky for human health and environmental health and should never be done. Instead, preferred technologies should be set up beforehand in a preparedness stage. Now, that is obviously always not possible for many reasons, but if emergency solutions are used, for example, if waste is buried on site after the emergency when things have settled down a bit, we really do need to follow up and make sure that those stopgap measures and emergency solutions are made safer both for people and for the environment. So finally, during COVID-19, integrated waste management is going to be stressed by both additional waste and by different types of waste. And if disasters hit, environmental and human health risks can be heightened. So additional measures are needed for environmentally sound management of waste, and preparedness and contingency planning are really key. During states of emergency, because government structures change, but also partners may change, we all need to be aware of and build our capacity around the need for environmentally safely managed waste during disasters on top of our current pandemic crisis. This is my email address, and I'm very happy to talk to you later and answer all questions that come up.
Thank you very much, Elisa. This is wonderful presentation. So we start thinking that this is a nature-based disaster, a health disaster, and then health disaster creating again the disaster for nature through these waste issues. So that's really a thought-provoking, and we'll be coming back to Lisa. But this vicious circle of nature and health and nature, how to break that? So I would like to invite Georgina Lloyd, our regional coordinator for the law in Asia Pacific region. Georgina, floor is yours, please.
Good afternoon, ladies and gentlemen. Thank you very much, Mushtaq. I'm going to be presenting on the significant challenges that exist for animal waste management generally, due to limitations in infrastructure, capacity, issues of inadequate regulation and control of animal conditions, which result in pollution and higher risks of disease infection and transmission. And secondly, I'm going to look at the further challenges that arise due to the illegal trade of wildlife, that by its very nature is high risk, both due to the handling of wildlife and that waste may be dumped. Also that due to the poor conditions that facilities used in the illegal wildlife trade may have. So to start, some background, a 2009 study by the World Bank found that while integrated solid waste management has been given a high priority in developing countries, often with great success, frequently urban livestock markets and related facilities, such as those used for captive breeding, wet markets, live animal sites, and slaughterhouses, are neglected, with improper waste management and treatment systems, and inadequate regulation and enforcement of pollution control and animal welfare. As Mushtaq alluded, these sites pose a very high risk to public health and the environment, as waste is not properly treated, handled, or disposed. As we've often been reminded recently, 2/3 of known infectious human pathogens have emerged from animals, with the majority of recently emerging pathogens originating in wildlife. Poorly managed animal waste and the trafficking of wildlife have adverse impacts on the environment and on human health, including but not limited to biodiversity loss, pollution of land and water, and public health problems, including the emergence of new disease, as well as more widespread disease vectors. The World Bank study that I alluded to previously found that the current situation of the treatment of animal waste in developing countries provides ideal conditions for the emergence of new diseases, particularly those that can be transmitted from animals to humans. So the poor management of waste at animal breeding and housing facilities can result from, for example, overcrowding, poor sanitary conditions, and insufficient access to water. This can increase the risk of cross-species transmission of pathogens, which of course can result in zoonotic disease. The fecal waste and other waste, such as respiratory secretions, urine, feathers, fur, or skin, of various livestock, feral, and wild animals, often contain high concentrations of human and animal pathogens. As the demand for meat and poultry increases globally, more facilities are forced to operate beyond intended capacity and are unable to appropriately treat the quantity of animal waste that is generated. Further, demand and consumption is driving greater human disturbance of natural habitats, increasing contact and pathogen transmission opportunities between domestic animals, wildlife, and humans. Thus, there is an increase in areas where wildlife and livestock animal contact opportunities are heightened. A 2015 study undertaken by UNEP has found that the intensification of livestock production in many parts of the world typically involving high animal density, confined living quarters, and antimicrobial use, have created conditions that might enable rapid pathogen spread and evolution. And yet, we see that animal waste management systems are rarely adequate. At animal facilities and wet markets involved in the meat production industry, in addition to dealing with animal manure, the amount of waste generated, which includes unused body tissue as well as other wastes and secretions such as blood, can include up to 60% of an animal's weight. The systems to address these wastes can be insufficient. There's a need also to improve management and regulation of the reuse and recycling of animal waste, a business that in some countries can often be as large as the slaughter business itself, and yet it is frequently unregulated. In many countries, large quantities of animal manure and poultry litter are used as fertilizer without any composting process, providing potential routes for disease spread through crops. It's important also to examine peri-urban and urban settings as a unique context. The informal rearing of animals and the unregulated animal facilities in these settings create a potential source of disease and result in noise, air, and water pollution. Exposure to livestock and other animal wastes in these congested urban settings provide aggravated conditions for the emerging diseases and vectors for transmission. Some examples of such diseases, of course, include SARS, avian influenza, encephalopathy from mad cow disease, West Nile, Lyme disease, and Ebola. In developing countries, urban and peri-urban settings have been found to have a high incidence of informal slaughter, either at the household level or illegally by local retail facilities. This again presents a significant problem for the control of waste, public health, and disease. Such sites may lack separation of clean and dirty areas, resulting in contamination. There may be limited sanitation of services or equipment, and facilities may have poor infrastructure, allowing for adequate separation of waste from the material that then is intended to be sold. Waste management at live animal wet markets similarly needs to be addressed, as the same situations may be found. And at these locations, there's the potential for both living and dead wildlife and domestic animals of various species and origins to converge and create conditions that create ideal environments for coronaviruses and other wildlife-borne diseases to spill over to humans. This is not a suggestion to close or wet markets, but there is a need for stricter control measures to reduce risks associated with the contact among animals and domestic animals, people and domestic animals and wildlife that harbor zoonotic pathogens. At such sites, it's also important to consider the treatment of wastewater and contaminated stormwater runoff. Liquid wastes may be discharged untreated into drains and local watercourses irrespective of other water users downstream. This may affect urban poor communities who potentially use water for bathing, washing clothes, cooking, and even drinking. There are also increased public health concerns, especially due to the occurrence of waterborne disease outbreaks caused by fecal contamination of manure origin. The high incidence of informal and illegal slaughtering of both legal and illegally traded animals results in many livestock and slaughter waste products being dumped illegally or disposed with municipal wastes. And this, as Lisa mentioned, causes cross-contamination, which can result in environmental pollution and can increase risks. Unwanted animal waste disposed at municipal disposal sites create risks because this is where municipal staff, waste pickers, and scavenging animals may have direct exposure. And as Lisa mentioned, these issues with the dumping and treatment of animal waste are magnified during disease outbreaks and during other disasters, where improper disposal and the dumping of diseased or other animal carcasses presents significant challenges and very serious public health concerns. As previously noted, the potential risks of animal waste for human and environmental health may be heightened as the result of wildlife trafficking. Of course, we understand that the illegal trade in animals forms part of the environmental crime, the monetary value of which is broadly estimated between 91 and 259 US billion dollars annually. As much as 25% of the international trade in wildlife and plants is thought to be illegal. This trade contributes to biodiversity loss, which is detrimental to human health. The UN Environmental Assembly Resolution 34 recognizes that biodiversity loss is a human health risk multiplier. Anthropogenic disturbance and biodiversity loss have been strongly linked to the increased prevalence and the elevated risk of zoonotic disease for a variety of pathogens. A 2015 report by UNEP, the World Health Organization, and the Convention on Biological Diversity Secretariat found, for example, that hantavirus prevalence is thought to increase when mammal diversity decreases. In order to address the risks from animal waste, particularly waste from high-risk species included in the exotic trade of animals, it is necessary to address broader issues in the implementation of laws to address illegal trade in wildlife. To avert future pandemics, it is therefore necessary to address the origins of zoonotic diseases. This requires more than addressing waste related to animal trade and sale, although of course ensuring adequate frameworks are in place for the treatment of animal waste is necessary. However, prioritizing human health and well-being necessitates measures to protect environmental and animal health. Acting to address illegal and in some contexts unregulated or underregulated trade. This includes enforcement of existing laws targeting the sale of illegally traded species. It also requires action to stop the illegal consumption of wildlife. But there are a number of solutions that exist, and these can be further explored. In many countries, legal tools are present to address risks from zoonosis associated with illegal trade and the animal trade and livestock industry. There is an identified need then to focus on strengthening implementation and enforcement of legal frameworks, both nationally and through international law, such as CITES. There are also many guidance tools available, such as recommendations established in the 2019 Guide to Addressing Zoonotic Diseases in Countries, developed by the World Health Organization, the FAO, and the World Organization for Animal Health. The current pandemic has highlighted the need to take a holistic approach to disease prevention, and this has been alluded by all of the previous speakers. Waste management needs to ensure that global and national responses are aligned with the Sustainable Development Goals, including SDG 15 of Life on Land. At the heart of environmental and human health measures should be the goal to conserve biodiversity and natural ecosystems through implementation of laws and policies to halt illegal trade in wildlife, and policies that take a One Health approach. It's recognized that blanket bans on animal trade or on animal markets will not work, and may indeed cause serious issues for food and economic insecurity. However, targeted responses which address waste management systems of live animal markets and similar facilities are necessarily alongside improvement of working practice and facility management. Finally, environmental impact assessment can be employed as a fundamental tool to address risks at sites of animal sale, housing, and processing. Thank you very much.
Thank you very much, Georgina. You brought us to raise a lot of awareness that when we walk into the wet markets, we know the environmental footprints, or when we visit the markets like Chatuchak with animals, we can know aware that what is like behind that and how we can. So not in sight, not in mind situation really affects a lot. So now thank you very much for all the speakers, and we have about 15 minutes for Q&A. So I would suggest that if the speakers don't mind to turn on their cameras, and then each speaker can go for 2 minutes to try to respond to the questions he or she likes to respond, and then we will see how much time is left. So with that, I would like to provide Afro the first, and then Lisa second, and Georgina third, and fourth myself, and then we will see how much time is there. So 2 minutes for each, please. So Afro, floor is yours, please.
Yes, thank you, Mushtaq. So I see that there is a question where you're asking for examples of countries that have set up health and medical waste frameworks. Just to mention at the beginning that most countries already have in place health and medical waste regulations, frameworks. The problem is, how do they deal now with an emergency? Because there's more waste, there's a variety of waste that they have to deal with. But now at the Law Division, we are carrying out research. We want to map out any additional regulations and emergency measures that countries have had to adopt to deal with the COVID situation. So I can already mention that in South Africa, for instance, in March 2020, the Department of Health released environmental health guidelines relating to COVID-19. And there is a guideline there specifically dealing with waste management monitoring with a focus on healthcare risk waste, including blood products, cultures, etc. And also in South Africa, again, the Environment, Forestry and Fisheries Department issued directions in terms of disaster management. Then in Asia, in China, there were several regulatory instruments adopted on the occasion of the COVID-19. There was a notice in January 2020 requiring all local departments of environment to take note of COVID-19 related waste and apply the requirements of the response plan that was adopted for the influenza, H1N1. And then if I can go a little bit to Europe, the EU issued in April 2020 the Commissioner on Environment, they issued a document titled Waste Management in the Context of the Coronavirus Crisis, where they reiterate that medical waste should be handled in accordance with the provisions of Hazardous Waste Directive 2008/98. And then also the individual member states took specific measures like Spain and Italy. And there were also a lot of regulations taken not only for the medical waste, but also for household waste. A lot of countries like Spain, Italy, or the UK issued guidance on how to handle and how to collect household waste, taking into account that they are potentially contaminated as well.
Thank you. So now over to Lisa, please.
Actually, I'm not sure if there are any particular questions aimed at me, so I might just say that there are a couple of questions on technologies that Mushtaq may answer, but just to let you know that UNEP also recorded a global waste webinar, which is on YouTube at the moment, that goes through in a lot more detailed preferred and less preferred technologies, so we can share the link to that.
Thank you, Lisa. So over to Georgina, please.
Thank you very much. I see that there is one comment related to consumer behavior. as it relates to wildlife trade and the trafficking of wildlife. And indeed, that is an important consideration that needs to be addressed. And there are a number of organizations, including UNEP, that are working to understand and address consumer behavior as it relates and the interrelation between national level policies, consumer approaches and behaviors, and frameworks for the regulation of trade. There's an example from UNEP under the Wild for Life program, and we can perhaps share some more information on that for participants that may be interested. But the core response is that you do need to have these legislative frameworks in place as the foundation upon which other layers can be added. And of course, it is a complex framework, and all of these things are also linked to different national contexts, cultural contexts, but those core frameworks and policies and regulations, as well as the policies around waste management associated with animals, are really important and fundamental. Thank you.
Thank you, Georgina. So let me try to pick up a few questions. So number one is from Jyoti from SCAP, asking for the costs and also the source of the funding. So many places, municipal waste, there's like that is the responsibility of the city governments. Though in the national level, it is a different, like in China, suppose Ministry of Construction that looks after that. In Thailand, Ministry of Interior that looks after the municipal. So the national governments on the environment side, they provide the guidance and so on, but not the funding. So that's from the national subsidies. That comes to trickle down to the cities, and then they have a city taxes, including the land taxes and so on. So that's basically cross-subsidized, and not much of direct taxes or the level of the direct taxes on the household waste. So what happens that in the city budgets, all the budget for the waste management is spent only on the collection, and still the collection rates are between the 50 and 70% in many of the cities. So there's no proper like a sanitary landfills or proper treatment and so on. And as we all know that in household waste, there's also a lot of medical waste included, and also in those facilities, a lot of other like industrial waste dumping and so forth, and also the animal waste, as Georgina was mentioning. So basically, that's where the whole challenge is, that there's no sufficient funding for the waste management in the system in many countries or cities, and also for the private sector, like hospitals, suppose they are responsible for their own waste. So they try to build their own like autoclaves and incineration processes and so forth. But that is also the enforcement issues and others. They do not make it like a really a very effective way. I remember during the SARS, for example, in China, they came up with a policy that all the hospitals should join hands, and they had a private company, which is a state supported, that collects all the waste and properly treats that waste. Because of the SARS, we saw a lot of damage to the economies and so forth. And so also that brings to the other questions in relation with the technology. Suppose in Philippines, the question came that there's not much on the treatment technologies of the medical waste, what to do. So the first and most immediate anyway is to properly store in a tight environment, so there's no leakages till there's a solutions found. Like in many places, I remember even in the Pacifics, there was the chemical like a waste and so on, which was properly stored. And later on, like with the support from the international agencies or the developed countries, that was brought to the proper treatment and so on. So that can be the immediate way. And as also Lisa already mentioned, that our webinar and also the fact sheet 3 is about the treatment technologies. So I would suggest to go into that, and we can have a detailed discussions. But UNEP, we provided a guidance on sustainability assessment of the technologies. So that is homegrown criteria at the strategic level and also at the operational level. So again, all the technologies has to have a geographical challenges, economic challenges, technical challenges, and so on. So we have to be ensured that they are properly chosen within the current situations of specific cities or countries. And also, as we have seen now, the rapid deployment of the thermal treatment. And the word of caution is always for the incineration that the capacities, because if incineration, they do not have the waste that makes it self-combustible, and also no proper technical capacity, then there's a fronds, dioxins, and other environmental hazards coming out of that. And also with everything burning, we lose the life cycles of recovery and recycling. So that's we have to be very important. Then Suga-san's question about this workshop being very general. Yes, as I mentioned that this is going to be overarching. So then we go into the specifics like technologies, regulatory frameworks, financing, business models, and so on in the next series of the dialogue. So this was just to provide overarching focus that why we are talking about the integrated waste management, and also bringing some of the important aspects which are more relevant with the pandemic related, for example, disaster waste, animal waste, and so on, which are not taken care in the normal integrated waste management system. So that's there. And one question came on the recycling, that why the rates go down. So as I mentioned, one is a fear of being infected. And number two, as the lockdown, many businesses, even the supply chains, they broke down. So that's also very important to see the resilience in the supply chains, even producing the protective equipment and the medical supplies, how we can close the loops that on the one hand we increase the recycling, but again then to provide the supply to the industries who are providing those health emergency equipments and so on. So that we have to really look into very carefully. So with that note, as time is getting up, so I will now request again our panelists like one final word from each of us, and then we go to the final session. So Afro, I'm coming back to you again, please.
Yes, thank you, Mushtaq. I think there was a question on specific examples, challenges and successful examples regarding, among other things, the legal issues. I think there was a lot said already about the challenges that countries had to navigate during this crisis situation and adopt the right measures to address the crisis. About successful examples, I don't know from a technical perspective. From a legal perspective, we are now carrying out research to map the different types of measures that countries adopt to deal with the emergency situation. So we are not really able to assess yet whether these measures were successful or not from a legal angle, but on a preliminary basis, what we observe is that a lot of these measures are guidance or manual, and this is because there were no provisions in the waste legislation or other legislation to adopt emergency measures for waste management. And what happens is that if we have guidance or manual that is issued, okay, this is only guidance, and there is a problem with the enforcement, because we cannot have penalties in a guidance document. And this is why in my presentation also I spoke about the enforcement and monitoring and about the legal basis for the adoption of the emergency measures. So we hope that when this study has been concluded, we are going to have more precise examples on what worked well and what did not work well from a legal perspective.
Thank you, Afro. Thank you very much. So over to Lisa, please.
Yes, I think I follow those comments very closely, because when we have to prepare and when we draft contingency planning, if we discuss disaster scenarios, if we talk about early warning, early action, all of those kinds of things that we do in disaster management, they're all under additional strain at the moment. And finding positive examples or concrete results in the region yet is quite difficult, because the disasters that we've experienced in the last couple of months are learning as they go. So the only key message again is preparedness. If our preparation is inadequate, then our response will be more difficult. In countries where waste management includes informal sectors, obviously the pressure is higher. When we have to engage between health, we have to engage between health managers, disaster managers, private companies and informal sectors. This is not easy. I'm not implying that any of this will be easy, but we do need to consider the situations that we may be facing in the next 6 to 12 months and think about waste in those terms.
Thank you, Lisa. So over to Georgina, please.
Thank you, Mushtaq. And I see that there's been a question posed by Manesh around the issue of the role of wet markets as an important source of food security, and yet also in some cases the linkages to illegal wildlife trade. And as I said, we do not think that blanket bans on wet markets is a solution. It's not a solution. Targeted responses are required. And those targeted responses do indeed need to reinforce the implementation and enforcement of existing laws that focus on illegal wildlife trade. In many cases, those laws do exist. It is a matter of further enhancing their ability to be adequately implemented and appropriately enforced. It's also an opportunity to look at the role of international law, particularly CITES, in the connections between illegal wildlife trade and health. And this is indeed something that discussions that are starting and are beginning to happen in the international sphere. I think that the pandemic has clearly indicated how and brought attention to the fact that the way that we interact with the environment has implications for human health. This is not new, but this has been strongly reinforced recently. And that also means that any approach we take has to be holistic and has to understand the broader environmental issues that need to be addressed, as well as the specific targeted responses. And that, I think, is one of the major take-homes from this series of presentations, is that there's a need for integrated approaches that go across multiple sectors. So you do need to focus specifically on enforcement of illegal trade in wildlife, but you also need to look at animal health and hygiene. You need to look at the meat production industry, need to look at animal welfare. There also is a need to look at the linkages that Lisa just presented in terms of the different sectors as they relate to disaster management. So again, it's a complex, but it really reinforces the need for holistic, integrated solutions to address these very complex problems.
Thank you, Georgina. So from my side, first of all, Wuhan example, for example, is an integrated approach. So they put in place medical waste additional efforts from the day one. So as a response, comprehensive response to cut off the roots of the infection or virus transformation. So that's why it's very important to look at it as an integrated part, that whenever we are talking about this, and I also mentioned as an integrated part to create the resilient supply chains as well when we're talking about the plastics and so on. But every country is different. They have a different systems. Like if you see, look, Japan, Korea, or even Thailand, we didn't find littering despite of lockdowns and all this. So every country is different. But the whole point is that we have to be aware of a polluter pay principle, extended producer responsibility. So those are very important. So it's all about, okay, we have our different food like preferences and so on, but how we really respond, that what we enjoy, we also responsible manner we do that. But we continue with this, and we will have more examples. We will add that into the next webinar and so on. And because of the time, I don't want to take more time. So now I would like to request our Deputy Regional Director and Deputy Representative for Asia and Pacific Office for United Nations Environment, program Dr. Isabel Lewis for the concluding remarks. Isabel, floor is yours. Isabel, you're mute.
Okay. Good evening, everybody. Thank you very much for this interesting discussion in the past hour or so on this very important and timely discussion. So, Excellencies, speakers, participants, colleagues, thank you for your active engagement, contribution to today's very interesting dialogue. As we all know, the current pandemic is not just a localized disaster. It is a global pandemic touching all of us in so many ways. From the overview presented by Dr. Mushtaq, incorporation of integrated waste management was emphasized as an essential and critical factor in disaster management, recovery planning, and actions. The main message of today's dialogue was that disaster waste management solutions must be integrated, not just the processes, interventions, but also the governance context. The top line issues identified were regulatory frameworks, institutional arrangements and enforcement, financing mechanisms, business models, technologies and infrastructure, especially the emerging world of digital transformation, and behavioral changes. Also highlighted and significant is the vulnerable populations, the informal sectors, the social protection considerations that have to be incorporated. We heard about the most specific examples of waste management needing attention, particularly plastic waste and animal waste. On governance, Aphrodite highlighted the provisions for expediting adoption of emergency short-term measures needed for the pandemic, but also being cautious of the type of instruments being chosen for adopting such measures in the short term, and that changes required for effective and agile response must be learned for the future, including monitoring and enforcement principles. With respect to managing waste on the principles of disaster waste during the pandemic, these are highlighted that waste collection, storage, and treatment systems are stressed by increased waste generation. PPEs, disinfectants, and so on. Environmental and human health risks are heightened by both the volume and type of waste. So additional measures were highlighted as being needed for environmentally sound management during pandemics and in preparation for disasters. And in the event of a disaster during the COVID-19 crisis, even more pressure is put on existing waste management, staff, capacity, technologies, and equipment. So a disaster may mean a longer-term environmental health crisis if the response is not properly planned and addressed. Preparedness and contingency planning should integrate waste management strategies at local, state, and national levels. Georgie highlighted the importance of addressing animal waste and also highlighting the impact of illegal trade of animals and the waste it generates. Advanced integrated solid waste management systems often do not include urban livestock and wet markets and related live animal facilities. So if not treated appropriately, waste from animals poses a high public health risk. Hidden waste likely to be poorly treated from a high-risk species, such as those subject to illegal trade, pose a potentially even greater risk for zoonotic diseases. Our speakers also shared many specific examples to reinforce their messages, which are very important to inform credible science and data, and thereby inform and influence policies for disaster response, integrated waste management. Solutions were also provided, including examples of monitoring and implementation tools. Generally, integrated waste management response to emergency disasters must be a business as usual principle, not just in response to a disaster. but for preparedness and readiness for future disasters, as well as a general principle for safeguarding human well-being and health, animal health, environment health, and sustainability at large. Integrated waste management is central to national and global pathways to sustainable development and should not reverse any progress to achieve the SDGs. In building back during pandemic recovery, businesses are an important partner as well. Collaboration is important in the recovery phase, example, jump-starting green small medium enterprises, providing support on the upstream and downstream of waste management, involving small medium enterprises in measures to improve waste management, healthcare waste management, and reducing impact on nature. So ladies and gentlemen, today, as we know, is the first in a planned series of sharing and learning in disaster and integrated waste management. UN Environment is engaging with member states, including with UN country teams, intergovernmental platforms to widen the experiences and solutions. We trust you have benefited from today's dialogue, and we also very much welcome your ideas for further topics that we can consider in our future dialogues. So once again, on behalf of UNEP, my thanks and appreciation to my colleagues, Dr. Mushtaq, and my speaker colleagues, Lisa, Aphrodite, and Georgie, for the analysis, invaluable sites, and all the participants who provided many inputs, including via the chat. Thank you again. I wish you a good morning and a good afternoon.
Thank you, Isabel. And now I have a final request to all of us. So for the next series of the dialogues and webinars, we will also be bringing the our partners, experts, and anyone who's even aware of any good practice, inventories, and so on. So if you would like to be the part of that, or you're want to post it there, can you please start sharing that or showing your interest to Mayan? And that will be really helpful. As I said, this is just a beginning, a first dialogue. So please feel free to have a bilateral interactions and so on. And I would like to really thank all my colleagues on screen, off screen, who helped us a lot. And thank you everyone for joining us. But please stay tuned for the next webinar and dialogue. Have a great day. Bye for now, please.